Mental health awareness, depression and anxiety. Depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Fortunately, it is also treatable. Depression causes feelings of sadness and a loss of interest in activities you once enjoyed. It can lead to a variety of emotional and physical problems and can decrease your ability to function at work and at home. How can we tell those with the symptoms of depression? Number 1. An unusually sad mood. You or someone you might know could be sadder than usual. They may be going through a tough time and feeling out of the blue. Number 2. Loss of enjoyment and interest in activities that you used to be enjoyable. Things that you usually enjoy in your day-to-day life could suddenly make you lose interest and feeling burned out of the things you love to do. People with depression may also face these symptoms. First one is lack of energy and tiredness. Feeling worthless or feeling guilty during they're really at fault. Thinking often about death or wishing to be dead. Difficulty concentrating or making decisions. Moving more slowly or sometimes becoming agitated and unable to settle down. Having difficulty sleeping or sleeping too much. Loss of interest in food or eating too much. Changes in eating habits may lead to either weight loss or weight gain. Who is affected by depression? While depression can affect anyone, there are certain segments of the population at higher risk for developing depression. For example, depression is more common among women than men. The median age of onset for depression is 32 years, meaning that half of people who will ever have a depressive episode will have had their first episode by this age. Additionally, depression often co-occurs with anxiety or substances use disorders, so people with these health challenges may also be at higher risk for developing depression. What can we do to help? Number 1. Start a conversation. Let someone you know who is feeling down that you are there for them. You can do this by sharing concern and asking specific questions that you can use to help them feel better. Listen well to their problems and try not to be pushy with questions if they don't feel comfortable with talking about them. Number 2. Help them find support. Your pal might not know they are dealing with depression or unsure on how to reach out for support. You could offer to help them with an acclaimed therapist as they are more suited for jobs like dealing with people who have depression. Encourage and support them to make that appointment happen as it also helps them greatly. Number 3. Support them in continuing therapy. There might be times that your friend may not feel like leaving the house. As we have talked about earlier, depression can also lead a person lose their energy and motivation to do certain things. Motivate them into continue therapy by saying things like, "Last week you said your session was really productive and you felt a lot better. Afterward, what if today's sessions helped too?" Number 4. Take care of yourself. When you care for someone who is living with depression, it may be tempting to always drop by to make sure everything is okay and always be by their side to support them. It's not wrong, but you should also learn to take care of yourself. Set boundaries and let your friend know that you are able to talk with them after you get some things done and not before. Number 5. Offer to help them with tasks. Depression can make you feel like tasks are overwhelming. Daily tasks such as house chore making it really hard to get by. You may offer to help them your friend achieve things that they need to be done. Put up some music and can make things less tiring. Number 6. Be patient. Depression is improved with treatment, but don't expect your friend to get over it overnight. It is a process that involves trial and error for that person to fully recover. Always remember that they are having a harder time than you are, and it might be best if you just help and support them. Number 7. Keep in touch. Letting your friend know that you are still with them as they work their way with problem can really help with their depression. Even at times where you can't always be with them and interact, a simple, "Hey, how is it going?" might be enough to make their day. Anxiety disorder. An anxiety disorder is a type of mental health condition. If you have an anxiety disorder, you may respond to certain things and situations with fear and dread. You may also experience physical signs of anxiety, such as pounding heart and sweating. Anxiety. People with anxiety disorder usually have recurring intrusive thoughts or concerns. They may avoid certain situations out of worry. They may also have physical symptoms such as sweating, trembling, dizziness, or a rapid heartbeat. Who is at risk for anxiety? Certain personality traits such as shyness or behavioral inhibition, feeling uncomfortable with and avoiding unfamiliar people, situations, or environment. Stressful or traumatic events in early childhood or adulthood. Family history of anxiety or other mental health conditions. Certain physical conditions including thyroid problems and heart arrhythmias. Unusual heart rhythms. Types of anxiety disorder. Generalized anxiety disorder or GAD is marked by excessive, exaggerated anxiety and worry about everyday life events for no obvious reason. People with symptoms of general anxiety disorder tend to always accept that disaster and can stop worrying about health, money, family, work, or school. Panic disorder. Panic disorder is a type of anxiety disorder. It causes panic attacks, which are sudden feelings of terror when there is no real danger. You may feel as if you are losing control. You may also have physical symptoms such as fast heartbeat rate. Phobias. A phobia is a type of anxiety disorder defined by a persistent and irrational fear of an object or situation. Examples of these are acrophobia, fear of spider, and claustrophobia, fear of tight spaces. Separation anxiety. Separation anxiety disorder or SAD is a type of mental health problem. A child with SAD worries a lot about being part of from family members or other close people. The child has a fear of being lost from their family or of something bad occurring to a family member if he, she, or he is not with the person. Anxiety can be caused by chemical imbalance. Severe or long-lasting stress can change the chemical balance that controls your mood. Experiencing a lot of stress over a long period can lead to anxiety disorder. Environmental factors. Experiencing a trauma might trigger an anxiety disorders, especially in someone who was rated a higher risk to start. Heredity. Anxiety disorder tend to run in families. You may inherit them from one or both parents, like eye color. How do I deal with anxiety? First, to relax. You may think that relaxing is as easy as kicking back on the sofa and watching your favorite shows or playing games. It has a false sense and relaxation that is only temporary. What your body really needs is practice of relaxation techniques like yoga and meditation to help calm you and put your mind at ease. Number 2. Get enough sleep, exercise, and eat healthy. Getting enough sleep is vital to keeping a peaceful and strong mind. Bundled together with relaxed exercise to keep you being healthy and making yourself feel confident and healthy. You should also consider trying to eat healthy snacks so you also gain extra energy for the day. And lastly, connect with peers. Keep in contact to those who are close to you, may be it your friends or family. Doing fun activities to those who are close and dear to us help deepen our bonds, which allows us to become supported and safe. If you feel nervous about some things, it's better that you lay those truth to those close ones. They might be able to soften that your fear you have.